The following program is an original production of WYCC PBS Chicago.
The new healthcare exchange is open with some computer glitches, but here in Illinois, the uninsured are finally finding affordable coverage. Still, the debate over healthcare reform rages on.
The city prepares for tens of thousands of runners and more than 1 million spectators. How will new security measures protect them all at Sunday's Chicago Marathon?
Plus, running with a purpose, a group of Chicagoans hit the streets to find a smoother road ahead. Those stories and much more tonight on In the Loop. Good evening. I'm Chris Bury.
And I'm Barbara Pinto. Tonight, an in-depth look at how the new Affordable Care Act is working in Illinois.
The battle over health care reform has led to a government shutdown that has already left thousands of federal employees in our area out of work.
Meanwhile, millions of Americans searching for insurance are jamming the online marketplace, including tens of thousands here in Illinois.
While there are many frustrating glitches, some who've struggled to find insurance before have finally found a safety net.
So this would be the first page that you would see when you come to the website.
59-year-old Will Wilson of North Suburban Highland Park is logging on to the new online health insurance marketplace. Just a few clicks and he ends up at the federal website, healthcare.gov.
Click on the green bar, green for go, apply now. And you can go. So because it's pretty busy this morning, this is what comes up.
Wilson encounters what many have complained about, a busy signal. Many Republicans in Washington, critical of the Affordable Care Act, say the computer glitches prove the program is too cumbersome to work. The Obama administration says the computer problems are merely growing pains and that the online healthcare marketplace is proving popular with millions of Americans. And Wilson says history suggests a little patience pays off.
2 months into the Medicare rollout, they were saying, oh, this isn't going to work. And 40 years later, people can't live without Medicare.
Despite the computer hang-ups, Wilson was among the very first in Illinois to take advantage of the new insurance market, logging on at 3 o'clock in the morning. After being diagnosed with AIDS 12 years ago, he found out his insurance policy at the time did not cover much.
I very quickly started having to pay things out of pocket, and within a year, I was about $150,000 in debt.
That forced Wilson into bankruptcy, and his pre-existing condition left him unable to get private insurance. So he found help under the Ryan White Care Act. It covers treatment for his AIDS, including special drugs that cost $3,500 a month.
And the thing about HIV is that those drugs are imperative. You don't have them, you die.
But in order to keep that Ryan White health care benefit, Wilson was not allowed to earn more than $33,000 a year. So he toiled away at jobs that paid very little.
You know, I have a couple of college degrees. I mean, I'm pretty well educated. I could earn a decent living, but the question came, do you want to make money and get sick and die? Or do you want to be poor and have health care?
59-year-old Gail Weiss of Chicago also turned to the new healthcare exchange. She's been living without medical insurance for about 15 years.
I'm frightened to death. I mean, it's very frightening.
Gail has tried to buy health insurance but can't because of her rheumatoid arthritis, a pre-existing condition.
Just the diagnosis of rheumatoid arthritis from mild above causes insurance companies to completely deny you insurance coverage.
Insurance companies that denied Gail coverage directed her to the state-run high-risk plan, but she simply could not afford those premiums.
And I did inquire, and it is true, they have to insure you. However, they don't have to make it affordable. And they wanted over $800 a month to insure me, and that's more than my mortgage payment.
Gail has been trying to log on to buy insurance in the new healthcare exchange since October 1st. But keeps getting the busy signal. Still, she's not worried. She already has plans for what she's going to do once her new insurance coverage kicks in.
Well, the first thing I'm going to do is I'm going to go to the doctor.
Will Wilson bought new health insurance online, a bronze plan with a deductible of $2,000. It covers doctor visits, hospital stays, prescriptions, immunizations, and more for a monthly premium of $325. He says that will allow him to pursue a better paying job without fear of losing coverage for his life-saving medications, giving him, above all, peace of mind.
There are so many freedoms that I'm going to have regarding health care.
Joining us today to help make sense of the Affordable Care Act is Crystal Thomas, Deputy Governor of Illinois. Thank you and welcome.
Thank you, Chris.
So we've heard these reports of a lot of people being frustrated by the computer glitches. Was the system not able to meet the demand?
Well, the good news is that our webpage in the state of Illinois, which is getcoveredillinois.gov, has been working, and people have been able to access that and to start educating themselves about the Affordable Care Act. Because we are a partnership state, we do link to the federal website, and we do know that there have been some glitches, and people are getting enrolled, but they do need to be patient. They do need to try several times, and we're encouraging people to do that.
We saw the woman in our setup piece who is patient, yet she's also a little frustrated because she's been trying since the first to get into that site.
We do understand, and obviously there are a lot of people, when we go online, we expect those websites to immediately load, and so what we encourage people to do is, one, take time, make sure that you're getting educated about the insurance, get educated about what the options truly are, and make sure that you're comfortable that the options are the right ones for you. Then you can go on and actually fill out the application and apply. And we do just encourage people, this is the beginning, it's not the end. People do have until December 15th to enroll for coverage starting January 1st. So if you're not able to do it last week or can't do it this week, there is going to be more time, and we just encourage people to keep trying back.
The gentleman in our setup piece had a pre-existing condition, HIV positive. If you have a pre-existing condition, are you going to pay more under this system?
Under this system, no. One of the great things about the Affordable Care Act is, one, you can't be denied because of a pre-existing condition.
No matter what it is.
No matter what it is. And number two, that you cannot be charged more because of health status. So health status is not one of the questions that you have to complete now when you fill out the application. And people will be able to shop for plans based on their geography, their age, their family size, and factors like that.
How many different plans are you able to actually look at?
When you get on the site, it will let you know, depending on where you are in the state, what plans are available in your area. So in the Chicago area, there's something around 67 plans that people will have access to. In Southern Illinois, I think it's around 28 plans. So it depends on where you are, but everybody in our state has choice.
You say you're not going to pay more if you have a pre-existing condition, but there are sliding scales. And what is that based on? Is that income?
Well, when I said people won't pay more, that is definitely based on the rates themselves. But you make a very important point that most people who shop for coverage on the marketplace will have access to premium subsidies. Those are provided to people on a sliding scale based on their income. So once you know your rate, so say for instance, the premium for that policy is $150 a month. But depending on your income, you might be eligible for a federal subsidy that might take your out-of-pocket cost for that premium down to $40 or $50 a month.
Can you give us a sense of the parameters? In other words, let's take a family of four. What is sort of the average that they're going to have to pay? Depending on what plan they choose, obviously, but can you give us sort of a low and a high end?
It really depends on that particular family situation, where they live in the state, and what type of coverage they're interested in. So there are different levels of coverage, from a bronze plan, a silver, a gold, or a platinum plan, and the premiums will differ, and the types of coverage will differ based on those policies and what level. So what we really encourage people to do is to get on the website, to take a look at those factors, and once they apply, they'll be able to compare those plans side by side and really make an educated decision about what's best for them.
Give us an idea of a difference between a bronze and a platinum. What does that mean?
Well, mainly it's about the out-of-pocket cost. So a bronze plan in general will have a lower monthly premium, but it will have a higher deductible and higher copays. A platinum plan will be the opposite. It may have a slightly higher premium for the month, but it will have less cost sharing. Most people will only have maybe a $10 or 10% copay on the services that they access. So It's based on the utilization. Somebody who is relatively healthy doesn't think that they'll be using a lot of health care necessarily, might go for a bronze plan. Someone who may know they have a chronic condition, know they might need to see their doctor more regularly, might think that it's a better deal for them to go for a platinum plan.
If I already have insurance but I want to shop around for a better deal, can I go to this website?
You can. And so people who have insurance, they either have bought it themselves on the individual market. Those people absolutely should come to our marketplace, see if they can get a better deal, see if they are eligible for the premium subsidies, which might make the policy, that they are purchasing even more affordable. If you have coverage through your employer, you can still come to the marketplace. There are questions in the application about whether you're employed and whether your employer offers coverage. You may not be eligible for a subsidy on the marketplace if you have employer-sponsored coverage, but it's still something that you can go online and you can shop and compare based on what's available versus your employer plan.
Is the idea to eventually open it up so this is a big marketplace with lots of competition so people can truly shop for health insurance?
Well, we definitely want this to be a real marketplace and want there to be a lot of competition. We think that we've accomplished that in Illinois. It is not a policy goal for people to leave their employer-sponsored plan, if that's what you're asking. That's not the goal, but the goal is for the people who either don't have insurance today or the people who have insurance but may lose it or have lost it. And we know that that's something that continues to happen out in our marketplace. This is going to be a great opportunity for those people. They're not going to be left on their own anymore. They're going to be able to get in and to get help buying insurance on their own.
There's a whole lot more to cover, but we appreciate your time. Very, very helpful. Thank you.
Thank you
so much. Now for other trending stories, extra security for the Chicago Marathon, and the federal shutdown may sideline more state workers. And here's Barbara with more.
Thanks, Chris. In addition to those stories, a proposed tax for commuters earning paychecks in the Loop. And there aren't enough napkins to clean up the mess one restaurant is in after cooking up a controversial special. In the wake of Boston's deadly marathon bombings, Chicago secures its 26-mile route in preparation for Sunday's big race.
We're going to have eyes on the ground on just about every foot of the marathon route.
Are Chicagoans in favor of continuing the tradition?
I think it's a good idea to have a marathon. We shouldn't change the way that we live our lives because of terrorists.
Governor Quinn warns the federal government shutdown could cause long-term pain. Hundreds of additional state workers might be laid off if no resolution comes soon.
Hopefully stuff will change. I think it will, honestly. I think that it's going to get back to where it needs to be, but it's terrifying.
If you live in the burbs and work in the Loop, you should pay with a commuter tax. That's what one watchdog group is proposing.
It's a horrible idea.
I don't think it's fair. Why? I think they should encourage people coming from all over.
The group reports downtown Chicago gained more than 52,000 jobs between 2000 and 2011, but only 25% of them were filled by city residents. A Chicago burger joint has taken one juicy bite of controversy. It's serving the Ghost Burger, topped off with a communion wafer and red wine reduction simulating the blood of Christ. Is this tasty or tasteless?
I've been a cultural Catholic. I've tasted the wafers. They're tasteless and really, really just a little bit crispy. It's a texture thing.
You can get the burger without the wafer, so I don't think there's anything to be afraid of there.
Sitting with us to serve up their takes on these stories are poet, author, and artistic director of Young Chicago Authors, Kevin Koval, Amisha Patel, Executive Director of Grassroots Collaborative, and Ernest Sanders, General Manager for Gigabit Squared Chicago. Thank you all for joining us.
Thanks.
Thank you.
The Chicago Marathon kicks off this Sunday. Ernie, you'll be running it. Amisha, you ran last year. Security this year, though, will be tighter than ever. They're talking about undercover officers, bomb-sniffing dogs, surveillance cameras, new restrictions and bag checks. Kevin, is that enough?
Well, I'm sure it'll be fine. I think it would be great if they took the same kind of care to make sure that our parks on a daily basis were as safe. Last night there were 4 people murdered in Chicago, and the same kind of hysteria that exists over this potential fear of ours isn't as grand when it happens in communities that aren't really going to be necessarily running in the marathon. You know, the parks that we have, kids running every day in certain communities in this neighborhood are not safe. But we don't take the same kind of security measures and invest in the same kind of resources to ensure they're a safe run to school. You know? And I think that's a problem.
When you talk about safety and the marathon, Ernie, you're running this year. Any concerns about your safety as a runner in this event?
Sure. I guess my first concern is that I finish. Yeah, but more importantly, I agree with Kevin. The amount of resources that are exhausted to provide safety for 1 million plus folks who will be on site, I think could be better spent in the communities. I understand the city's position with wanting to provide safety in lieu of what happened in Boston and everything. But there are people who have been coming. This has been a tradition for them over the years, and now to change script at the last hour seems a bit difficult. So this is my first time running, and I want to invite my family and friends to be at the finish line, but I'm really uncertain of how to make that happen now, just because of all of these recent changes.
Yeah, they're not allowing people to gather at the finish line, and only runners could come in at the start. Yeah. We talk about the allocation of resources here in terms of security and safety. These events have become clearly potential targets. Amisha, is this something that cities may need to reevaluate? I mean, may events like this become too costly in terms of security to put on?
But I do think it's a larger question of where are the resources going. Running the marathon last year, I have to say it's sort of the feel-good event in Chicago. Like, everyone's really happy and they're cheering for you, and it's an amazing day. I think having these sort of experiences and these events are important to have. That being said, I think we have to talk about what are the priorities of the city and all of our cities. And there is so much hype about what's safe and what terrorism is. And I think it's true, the reality of how many people in the city and across the country are living in terror every day. That doesn't get talked about. And I think we have to look at that. There's a larger expense here that we've got to handle, and that's being faced every day by communities of color in the city.
Clearly, this is an event that brings a lot of people and a lot of money into the city, and that seems to be why the city wants, and other cities want to do events like this. When you look at this, and how the event has changed over time in terms of providing security for people who run it, do you think fewer people may want to run a marathon if it feels more like the TSA?
That's very interesting. It being my first time again, I don't think runners think that way. I think, it is the pinnacle point of your training for the year. And whether it be Chicago Marathon or some other city's marathon, I think runners particularly look to have these sort of events to say that they've made it this far. They've come to the mountaintop, if you will. And really running, in my opinion, is bigger than just me. So many other folks have followed my training, and now they've graduated to running. And so, that deals with issues when you're talking about obesity and self-confidence and things of that nature. I think these sort of events have to continue for the betterment of society.
We'll wish you well on Sunday and switch gears here. Let's talk about the government shutdown now in its 10th day. Governor Quinn has sent a letter to House Speaker John Boehner asking for a quick resolution to this. Some state workers have gone back to work after furloughs here in Illinois, but there's concern that if this isn't rolled back quickly, hundreds more could be laid off, including safety inspectors and caregivers for people with disabilities. Amisha, is this any way to run a government?
Absolutely not. Actually, there's a really great comedian named Hari Kondabolu, and he had this joke that said, in most of the world, people shut down the government for losing their rights. In our country, we shut it down for getting more rights. It's ridiculous. This is about healthcare access to millions of people across this country who don't have it. And instead of actually, what folks are doing is using this, it's all about politics. It's about using this issue to get back at the president, to sort of make a point that's political, and it's not about good policy or what's good for this country.
Kevin, what does it say about our country, and is this an acceptable way to negotiate?
I would say no, and it's millionaires fighting over millions. I like what Governor Quinn did, because I think folks who rely check to check on that income are going to struggle if they don't get if they don't get paid. My dad lives check to check. My mom's lived check to check. And I think that it's the same old story, that this country is run by those who have an abundant amount. The CEOs of major organizations and companies in this city will not suffer because of a government shutdown, but it'll be those who continue to live on the 9-to-5 pittance, really. And I think that inequity is the thing that needs to be addressed constantly. But we continue to uphold these, ridiculous ideas that the folks in Washington are really representing our daily needs and our concerns, and they don't, of course.
Now we have both sides here, each claiming to be the voice of moderation and saying that the other side has run off the rails. Ernie, how do you think this is playing to voters?
Sure. If I could just take a step back to reply to what Kevin said, I almost wish that the Congress employs what happened here in Illinois, what Governor Quid did regarding the pension and not paying the legislators. While I disapproved of it in many respects, I agree with it from the standpoint that, hey, if you can't do your job, why should you get paid? Certainly that would be the case in my arena, that if I didn't do a job, I wouldn't get paid for it. And I think the same thing is happening now. Congress, the president talks about Congress operating in crisis mode and how we need to really get away from that. And I really would love to see that happen here.
There's been some powerful rhetoric, words used like hijacking and ransom in trying to move this forward. I mean, is this a productive discussion, Amisha? Can you see a resolution here?
It's hard to see it because I think at least anytime soon, and I do think that the sort of where the public is actually is pretty clear. There's polling that just came out that said 24% of folks blame Republican lawmakers, about 35% blame Democratic lawmakers, and 45%. Sorry, the other way around. 45% actually, actually think that it's not the president's fault. It's people actually do. There is a change in the way that people see this. It's not just that we think that it's two sides and they're both not coming to a solution. Folks really do see that Republicans need to step up and end the crisis and get the country back and moving.
Another bit of unfortunate news: an AP poll just found that the approval rating for Congress was somewhere around 5% in all of this.
But that's a great piece of news, actually, because really, we need people in office who are a lot more like us, as opposed to, millionaire lawyers and business persons. We need people who have the necessity to get that check, and so they'll know that they can't cut the pay of long-term health care workers. That's ridiculous.
Okay, we have to move quickly on to our next topic, the commuter tax. Your group, the Grassroots Collaborative, found that the city of Chicago gained 52,000 jobs over a 10-year period, but only 1 in every 4 of those jobs went to city residents. One of the proposals, a commuter tax for people who work in the city and live outside the city. We'll ask you what you think in a minute, but Ernie, is that a good idea?
It was the first that I've heard of the study, and after reviewing it, I thought it was great. It was really interesting because from my work in community and economic development, there are communities who are suffering because of the unemployment rate and can't get jobs necessarily because you have folks coming in town. So I really appreciated the study. I think it's a good deal.
Kevin, your thoughts?
Yeah, I'm a fan of Amisha and her organization, so I think it's a good move. I think that a way to, of course, also address this issue is to have corporations who skirt out on the taxes that they're meant to pay in the city to really pay those taxes. I think if we were to do our job of ensuring that giant corporations, multinationals, pay their fair share, we might not have to have this commuter tax.
Amisha, some would say, isn't this kind of Peter Panning? You're taking jobs from one community and giving them to another.
Well, I think the point of our study, what we found, is the fact that 52,000 new jobs in downtown have happened over 10 years, which is great. At the same time, though, the city has spent over $1 billion in subsidies to get those corporations to come into that area. But then Chicago workers aren't actually getting the job. So in fact, Chicago taxpayers are paying for these corporations to come in, but then they're bringing workers in from the collar counties. That actually doesn't make sense for Chicago taxpayers. Why are we subsidizing suburban jobs? That's actually, I think, the crux of this study, and I think what we need to talk about. And then the fact also, when you look at who's getting the jobs, even in those 1 in 4 jobs that are going to Chicago residents, they are primarily being taken by white workers. Like when you look at majority zip codes that are African American in the city, they've lost an average of 600 downtown jobs in this period per zip code. There's something going on here, and there's a racial impact to what's happening and to how we're using our resources. And I think what this calls into, we have to come up with a whole lot of strategies, not just one. And right now, the city has been pretty focused on one strategy, and that's giving corporate handouts to anyone who asks for it.
I guess the larger question here is why aren't city residents getting those jobs?
That's right. I mean, I think, and our study really goes to looking at, I think there's a question of the skills gap that's growing. We're not, it's no coincidence. The mayor has shut down 50 schools, primarily in black neighborhoods. And then we wonder why, African-American, Latino workers aren't ready for good jobs.
All right, thank you. We'll have to leave it there. We'll get to our restaurant dispute in the after show. For now, Kevin Cavell, Amisha Patel, and Ernest Sanders, thank you very much. The Chicago Marathon is October 13th, just 3 days away. Among the thousands of participants are 6 remarkable Chicagoans running to escape their past.
God, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. God's will, not ours.
Let's run. 3 times a week before sunrise, a dedicated group of men and women lace up their sneakers and head out. But this is no ordinary jog. This program, called Back on My Feet, helps the homeless get back on their feet using the discipline of running.
And what I think people get out of Back on My Feet is what's possible. We start off with 1 mile. Most members don't think they can actually run that 1 mile, and they do it. And they think, oh my gosh, what else is possible? What else might I be able to achieve?
It's a concept that seems to work, but the idea was a tough sell at first.
Started back in Philly in 2007 with our founder, Ann Malum, and she was running by this homeless shelter when she thought, I know what I get out of running, and I wonder if these guys might get the same thing out of running that I do. So she went into the shelter and talked to the director there and said, I really am interested in starting a running club. And of course the director was like, yeah, I think that's a little crazy. I don't think homeless people are really interested in running, but you're welcome to try. And she went in that day and talked to them, and the very next day 9 guys came out, and that was the birth of Back on My Feet.
6 years later, Back on My Feet chapters are up and running in 10 major cities nationwide. The Chicago branch partners with St. Leonard's House. Together, they offer housing, education, and help finding jobs, a blessing for those with a history of homelessness and other challenges.
I'm 53 years old. Been in prison. My alcohol addiction has put me through a lot of changes in life. I was 7 years clean and sober, got my life together, relapsed, was homeless, living in the streets and stuff like that. Now I'm clean and sober 9 years, and it's a daily struggle, so I don't make the same mistakes again. Back on my feet. This is my apartment. I just moved here in June. Back on My Feet gave me the security deposit so I could move in. When you walk into your own place, it's an accomplishment, You feel like you did something, Without the opportunities from Back on My Feet or St. Leonard's, I wouldn't have what I have today.
Red's list of recent accomplishments is long, but his personal goal involves only sheer will and sneakers. His focus, Sunday's Chicago Marathon.
My thing is, I'm going to finish the marathon, even if my legs won't keep going, if I got to crawl.
Good luck, Red. We'll be cheering for you. For more information on Back on My Feet, click on the link on our website, wycc.org/intheloop, to learn how the program helps change lives 1 mile, 1 job, and 1 home at a time.
Well, that does it for us tonight. You are now in the loop. The conversation continues right now on wycc.org. We'll talk about Kumas.
We will.
I'm Chris Beard.
And I'm Barbara Pinto. Until next week, good night.